The new advisory for testing of COVID-19 is purposive testing, and a new protocol for treatment of COVID-19 has been released by the ICMR. To talk on this, the variant of Omicron and its spread in the country, we have the ICMR's head of epidemiology, Dr. Samiran Panda. Sir, welcome to Mirror Now. Thank you for taking out time. My first question to you is on the purposive testing strategy which the ICMR talks about. We are seeing that the metropolitans are recording large number of cases. With testing guidelines being tweaked, we are seeing less number of testing being done, and still the positivity is very high. How do you see this high number of cases being reported, and still the testing strategy suggests that only symptomatic cases are to be tested first?
So now we are in January 2022. The epidemic was there with us in the month of January 2021. And it was also there, recognized, in the month of January 2020. One could think that the epidemic is static. So the testing strategy, which was there in January 2021, and that would also remain, or should remain, some people might think, should remain static or the same in 2022. That doesn't make sense, because if the epidemic is changing, if the force of infection is changing, if the goal cannot be anymore identifying a few infections and then containment and zonal distribution, that does not exist. When the community transmission takes place, it becomes almost impossible to identify an infected individual traced back to the source from where he or she got the infection. So the states need to have their tests ramped up so that the appropriate nature of the state-specific epidemic can be characterized, and the extent of infection can be figured out. But that has got nothing to do with the reduced number of the infected individuals. So the point I'm trying to make is that if someone is asymptomatic in a family where there is one who is symptomatic, the latest guideline clearly says, although the asymptomatic individual does not need to go ahead and do a test, because there are available tests of different kinds, molecular tests, home-based tests, rapid antigen tests. But if I'm asymptomatic, the most important, at the individual level, the most important thing is for me to monitor my health and to identify at the earliest if I'm getting infected due to the development of the symptoms and take appropriate measures. Now, Omicron variant being the predominantly circulating variant, we know that majority of the infected individuals will remain asymptomatic. A few who are symptomatic are mildly symptomatic. In the hospitals, severe disease or deaths which are being recorded are mostly due to the comorbidities. If I have liver cirrhosis or cancer or any other comorbidity. In this regard, I would like to highlight one more thing that has been included in the recent treatment guideline that talks about tuberculosis needing to be recognized as a comorbidity, because if the cough persists for more than 3 weeks or so, it's not getting better. So maybe one is having tuberculosis. Similarly, any immunosuppressed conditions like HIV could be another. So these are all renewed considerations and the epidemiologic status of the disease in the community and the changing scenario that we are now in at 2022 and the rapid transmission ability of the variant Omicron. All of these factors are guiding the latest testing strategy and the COVID-19 pandemic management strategy.
Dr. Panda, if we talk about the last interview, when we interacted, you had said that the intensity of third wave is not going to be like that of the second wave. We are seeing the case rise of about 7 months high, but the number is nowhere close to what we saw in the peak of a second wave. What do you assess of this situation? If we talk about the way forward, are we going to see a rise in number of cases, or have the cases started stagnating, or we are going to see the decline of the cases in the coming days?
We have to differentiate between three things mostly. One is the number of infected individuals. Now, anybody who is infected is an infected individual, but he or she might not be necessarily having symptoms. So the total number of infected individuals might go very high in terms of the number, if somebody wishes to do a head count. But that doesn't really serve any purpose, because it will be a mix of asymptomatic individuals and a few symptomatic individuals. But the total number of infected individuals, even if it could go very high, the cases, when we say case, a case is an individual who is symptomatic. The cases which showed up in the hospitals, creating a pressure on the healthcare system during the second wave, that we projected would be very less in a variant which might have a transmission efficiency and immune escape phenomena. We projected through our model, which is ICMR Imperial College collaborative model, the name of which is chromic model. We projected that the symptomatic cases would be fewer, and that's exactly what we have been seeing in India, not only in India, in other countries as well. And the other number is the number of hospitalized individuals who might require ventilator support or oxygen support, or deaths isn't happening. So we now clearly are seeing a picture emerging where those who require ventilators or oxygen support or are experiencing the unfortunate events of death are individuals who had some comorbidity for which they came to the hospital and were identified to be also infected with COVID-19. So it's not only COVID disease status that pushed them to an advanced stage of the disease. So that's how Omicron behaves differently when compared with the Delta variant of SARS-CoV-2 infection. So yes, the number of infected individuals might go quite high due to the high transmission efficiency of the Omicron variant. However, we are not expecting number of symptomatic individuals requiring hospitalized treatment going high. So there is a disconnect, which is a good news. And we are also seeing that most of the mildly symptomatic individuals can be treated or managed at home. That's why this home care guideline and the very few proportion, a very less proportion of individuals requiring oxygen or ventilator support are actually individuals who have other comorbidities that required such support.
So, Dr. Panda, we wanted to focus on the case numbers because we have seen India reporting over 260,000 cases in the third wave. And for the past few days, because of this new testing strategy, we are recording less number of positive cases if compared to the figure for past few days. Is this a trend? Are we going to see a decline, or do we still need some time to assess this situation? Or is this trend going to continue? Can you comment on that?
I think only time will tell, but we should wait for 3 weeks, because for any trend to be observed, 3 time points data become necessary. So you do not take a decision about 1 time point data, about a trend. So in order to know whether this trend will persist or is persisting, one need to wait for the next 3 to 4 weeks. If you remember, 11th December was the date when presence of Omicron was recorded and noticed and reported from India. And if you take 3 months' time, it's actually 11th of February. So today it is 18th of January. And if you wait for 3 more weeks, characterization of the trend would be clear. Now here, I want to underline that states would have their respective trend line drawn, and that should be drawn based on the state-specific data. Because Delhi, Mumbai, Calcutta, these are the major metropolitan cities with high population density, recorded Omicron, and it also spread there fast because of the environment which was there in terms of population density and mixing between different groups. So different states might have different time frame in terms of when the infected number of individuals, that would peak or reach a peak, and then when it would start coming down. But the way things are, we can expect things to be settling down by end March, if I take the whole country into account. But some of the states would naturally achieve this state a little earlier because they witnessed the transmission of Omicron happening earlier compared to the other states.
Dr. Panda, a majority of cases which are being reported right now, it is being said that somewhere the reinfection is there is a breakthrough infection that is taking place due to Omicron. What is your analysis in this? How significant is this? And how does the ICMR view of the current scenario of breakthrough and the reinfection of the cases seen due to the Omicron variant?
First of all, reinfection is if I got infected earlier and then I got infected again, and these two events of infection are proven to be two different events, not continuation of one infection even persisting for long, if we are sure about that, then the definition is reinfection. That's what is known as reinfection. In terms of breakthrough infection, 14 days or more passed by after the second dose of vaccination. And then if somebody gets an infection, by definition, that's a breakthrough infection. So breakthrough infection is infection in an individual who has crossed 14 days or more after the second dose and then got infected. Now, this is not surprising because infections happen through the activities that we are all we're aware of, which is like coughing, sneezing, talking, singing, and the infected water droplets go from one to another. And then the infected individual, if an infected individual is in close proximity to susceptible masses and there's mass gathering or in the marketplace or in a political rally or for religious events or even for societal events, any event that is, bringing people together, that togetherness without appropriate use of COVID-appropriate behavior or protective behavior, then it is possible to get the virus, infecting us through the nasal cavity or oral cavity. So acquisition of the infection is not prevented by the vaccine. But what does the vaccine do? It reduces the severity of a disease state once infection is acquired. So what I would say that the breakthrough infections would happen. I mean, it's known, I have repeatedly underlined that the vaccines are not infection-preventing vaccines, but they're disease-modifying vaccines. So the disease doesn't go to the advanced stage. That's what we are aware of. So if we really want to prevent the acquisition of infection, we should try prevent occurrence of events or phenomena that creates a conducive environment for the virus to spread, which is population density, mixing between different population groups, taking non-essential travels, be it within India or in the Southeast Asia or South Asian countries, because tourism is a great thing in some of the countries, neighboring countries, and also in some parts, some states within India. So if we could sort of avoid these things for the time being, if we observe COVID-appropriate behavior, the speed of spread of infection will be less.
Dr. Panda, we are talking at a time when ICMR has released the new treatment protocol. We are not seeing molnupiravir. Of course, it was said that it won't be included in the new treatment protocol. But at the same time, the much talked about monoclonal antibody cocktail is also not there. The anticoagulants use is not there. If you can comment on that, what actually transpired in a meeting in which these discussions were on?
Any treatment guideline serves as a dynamic document. It's not, as you must have seen, all of us have seen that from 2020 through 2021 and now 2022, the emerging evidence have always been taken into account. They have been synthesized. And the National Task Force meets at regular intervals, and they look into the strength of evidence. And based on that, the guidelines go through necessary changes. So hope is one. Of course, in a pandemic situation, when you do not have any definitive treatment, people do try see could repurposing of drug be of any help. So and also regulatory practices, which is there in a country in terms of people in the society and over-the-counter availability of a medicine, the chance of inappropriate use of medicine. So all of these have their respective, side effects and adverse events on us. So yes, emergency use authorization of molnupiravir was there, but that does not necessarily mean that it should create or lead to a situation where anybody and everybody tries to access molnupiravir and starts having it without necessarily taking into cognizance what are the probable side effects or adverse effects associated with it. So I would say that the way the epidemic is going now and the way the home-based care guideline has been uploaded, the ICMR home-based care guideline with infographics, which is very easy to understand. And then the monitoring of body temperature and the monitoring of oxygen saturation would really help one to quickly, have a resolution of the symptoms, number one. Number two, inappropriate use of antibiotics, Antibiotics do not work until analysis is indicated, and that decision should be taken by a treating physician, not through self-administration of medicine. Similarly, for antivirals or, for example, steroids, we must have seen that too early and too much and too long usage of steroid led to invasive fungal infection. Of course, it was a misnomer or black fungus, but that invasive rhinocerebral-ocular, mucormycosis was almost like a satellite epidemic. So all these are were resulting from the self-medication, self-administration of medicine, so over-the-counter availability of medicine. So it's not having a medicine, name in a guideline. One has to also consider what would happen due to its inappropriate use, and those notes of cautions are being indicated. And always it is being underlined that consult a treating physician before, taking anything, because in terms of antibiotics or antivirals or monoclonal antibody, because nothing is a panacea. And every medicine or pharmacologic intervention has its own specific requirements or set of guiding principles. So everything won't work at any time if administered. So that's not the way treatment works. So we have learned to have a cautious step observed rather than, not or taking any, medicinal or pharmacologic intervention lightly. That might have a disastrous effect on our health.
Dr. Panda, since you are the part of the National Task Force also, if you can tell us about the lowering of vaccination for age group of children below the age of 15 years, because it is being said that it will start eventually. And also, if we are going to see the uses of Corbevax and Covovax in the pediatric population, the age group of 12 to 14.
I believe that the immunization division of the Ministry of Health and Family Welfare are taking the evidence which is there. They get advised by the National Technical Advisory Group on Immunization. So people are keeping a track of the emerging evidence. Subject expert committee of the Drug Controller General of India, who advises, the subject expert committee advises the Drug Controller General of India. So all of these are in place. So I would wait and see how the public health decisions are being taken. But 15 to 18 is actually adolescent age group, and they are going to be adults. And some of them, in addition to the studies, also are involved in some income generation activities. So it has been quite logical to start vaccination in that group because the vulnerability due to exposure to other population groups are much more. So these public health decisions are taken by the immunization division. And I will wait and see. And people are taking into cognizance the emerging evidence, the availability of the vaccines, what types of vaccines to go with, etc. These decisions are all being considered, I'm sure.
Dr. Panda, the total number that we are reporting right now is from metropolitans and mostly the urban clusters like Delhi, Mumbai, Bengaluru. But there'll be a time in India when this virus transmission will be going to the rural areas, and the rural infection that we saw during the second wave. Do we have a plan there? How do you assess the situation that is going to be there once the virus is there in the rural area of this country?
I will say that's a very good question. Actually, the transmission of the virus and the present circulating variant, mostly it is Omicron. Of course, in some of the states, we are seeing Delta as well. But the mode of transmission remains the same. So in urban setting, it is observed first because the population density in these major metropolitan cities that we are talking about, the Delhi, Mumbai, Calcutta, Chennai, in Tamil Nadu. So the nature of the occupation people are involved in, the business places, hubs, and the population density, all of these create a conducive environment. But there is no reason to believe that the virus would not go to the rural areas. It would of course take a little more time because of the population density is becoming a bit rarefied. But it won't be surprising at all if one sees that. What one could expect is the infected number of individuals going up in rural setting after the urban areas have become saturated, because it's all about the availability of the susceptible individuals vis-a-vis the infected individuals. And when the susceptible individuals get infected, then you do not have any more susceptible individuals. So that's exactly. So susceptible mass, infected individuals, and the recovered population. And when one gets recovered, one also develops at the same time, following infection, the immunity against the infection. So in technical parlance, it is called SIR model: susceptible, infected, and recovered individuals. So it's all about the equation. That's the simplest model. And of course, there are other nuances in it. So in rural setting also it would happen. The moment we create, there is a situation which is conducive for the spread. So it has got nothing to do with an area being rural or an area being on the seaside or a coastal area or hilly area or urban area. That has got nothing to do with the conducive environment that facilitates the transmission of the virus.
Dr. Panda, my next question to you is about the predominance of Omicron variant, since it is a largely highly transmissible mutant. What is the challenge that lies ahead of ICMR? Because it is being talked about that the metropolitans are having a high percentage of Omicron variant, and there is also Delta present in the population. What are the challenges that lies ahead of ICMR in the coming future?
It's not just India, it's a global phenomena, and Omicron is in some countries replacing the predominantly circulating strain. For example, in South Africa, Omicron replaced Beta because that was the preceding circulating strain. So here we had Delta. So due to the high transmissibility, Omicron is expected to replace Delta. Now we are in a state where in some of the states, it's a mix of Delta and Omicron. In major metropolitan cities and the states like Tamil Nadu and Maharashtra, Omicron is slowly, gradually replacing Delta. And the concern is about the behavior of the mass, and also our careful tracking of the epidemic, which is happening. And there are good things which are happening in terms of a majority of the symptomatic cases remaining mild, and they are being handled in home. So the challenge is to get the scientific messages across rather than doing a panic.
Thank you, Dr. Panda, for taking out time and speaking to us at Mirror Now. It was an absolute pleasure having you here.